Topic that I'm particularly passionate about and have been for a really long time, but especially after I had my own 2 babies. I've got a 6-month-old, so not long come out of a postpartum period myself. Massive thank you as well to the Maternity and Midwifery Forum for having me speak today as well. So my name is Louise. I am also known as the Modern Midwife online. I am a midwife of more than 12 years. I don't know how that's happened. And as mentioned, I'm a mum of 2 as well. I've got a little bit of a social media following where you'll find me at the Modern Midwife. And I've got 2 books published by Penguin, The Modern Midwife's Guide to Pregnancy, Birth and Beyond. And I've got a second book that's just been released, The Modern Midwife's Guide to the First Year. So the agenda this morning, as I mentioned, I'm going to speak about closing the gaps in postpartum care. We are going to talk about the vital importance of iron during pregnancy and the postnatal period, iron deficiency anemia and the impacts for both mum and baby, current guidelines, challenges of oral iron supplementation, which I'm sure a lot of you will be aware of, and then I'm going to offer some solutions and recommendations. So the importance of iron. So there's around about a 30 to 40 year period that iron plays a vital role and is a nutritional foundation for women. Active Iron have identified 3 in particular, 3 life stages. So that's preconception from the first period, and pregnancy and the postpartum period. But that does go all the way through to perimenopausal. And throughout this time as well, there are many women in particular that are dissatisfied iron users throughout that 30 to 40 year period. Oh, and around about 1 in 4 women are impacted by iron deficiency anemia as well. So the prevalence of iron deficiency anemia, it is a global nutritional problem. At present, there are 2.1 billion people living with iron deficiency. The prevalence of iron deficiency during pregnancy is around about 37% globally, and it's 23% here in the UK. And that actually increases to up to 40% postnatally, according to NHS Blood and Transplant, which I think is a massive statistic that we often perhaps don't think about. We talk a lot about iron during pregnancy, but actually postnatally, it's really important, and up to 40% of women are deficient. This also demonstrates an ongoing global maternal health inequalities. We can see here from the 2 statistics, 37% globally and 23% here in the UK. So iron deficiency and anemia, it is a progressive process, as I'm sure many of us are aware of. We will see normal iron storage and also functional iron in the body. But actually, it's not until those iron stores are completely depleted that we then see low HBs and therefore anemia. So we have this window of opportunity prior to us getting anemic for us to intervene. And I know that a lot of hospital units now are recommending that we take ferritin at booking by way of intervening early. However, units that aren't doing that could possibly consider, or also in our own practice, we can consider the individualised care, and if that woman it may seem as though she has got a quote-unquote normal HB, however, her iron stores may well be depleted, and therefore she may well be on that progressive journey to anemia. So the importance of iron during pregnancy. So iron deficiency anemia is more likely in women of a reproductive age, and that's because of menstrual blood loss. Around about 10 to 20% of menstruating women are already deficient pre-conception, which again, that's a massive statistic. Iron requirements are around about 3 times higher during pregnancy. Of course, the maternal body has to support not only the growing baby, but also the placenta, so the fetal placenta unit, and also we require more iron, more functional iron as well for the growth of that baby. So that the increase in blood volume is around about 30 to 50%, some stating specifically 48%. And once deficient during pregnancy, diet alone just won't replenish levels, and that's when we will need to, of course, intervene and treat mums with high-dose ferrous sulfate usually, and we'll talk a little bit more about the consequences of that. So as mentioned already, 23% of women in the UK become anemic, and that increases to 40% postnatally. The other thing as well that I was thinking about the other day, if there was anything else during pregnancy that impacted 23% of women, I do think that there would perhaps be more discussion about these impacts, but sometimes I do feel as though anemia during pregnancy actually is left out of those early conversations. So the consequences of low iron for both mum and baby. Low iron during pregnancy increases the risk of serious complications for both mum and baby. Some of those, there are more, but these are not limited to these. Increased risk of maternal, perinatal and neonatal mortality. Low birth weight, I think probably is the one that's most commonly quoted. Preterm birth, postpartum hemorrhage, maternal postpartum fatigue and depressive symptoms. So there's now emerging research and growing body of evidence that demonstrates that relationship between depressive symptoms and anemia. Infant iron deficiency in the first 3 months of life as well. And beyond, another piece of research demonstrates that infants at 9 months of age, if their mothers were deficient during pregnancy, that they are still demonstrating signs of low iron. So maternal postpartum fatigue and depressive symptoms. As we know, postpartum depression is one of the most common mental health disorders during the postnatal period, and up to 20% of new mothers experience a mental health condition. And many of them do go unreported, so I'm sure, like yourself, I suspect that that statistic is quite a bit higher. NCT conducted a survey, I believe it was called Left to Your Own Devices, and 1 in 8 of those women that were surveyed were highly critical of their postnatal care. And this is no secret. I mean, we talk a lot about postnatal care and that being the Cinderella service of maternity. So iron deficiency anemia can impact the mental health of pregnant women and impact cognitive function alongside mood, which I will touch on a little bit later, and the impact of anemia on neurotransmitters within the brain. So the current guidelines surrounding iron deficiency anemia, again, I'm sure that we are familiar with these, so really brief recap. Anemia is defined as a HB of less than 110 in the first trimester, but as we spoke about earlier, that mums may well be on that progressive journey before we see a low HB. It's 105 in the second trimester and 100 in the postnatal period. So the guidelines, again, we'll be familiar with these, but iron levels should be checked at booking appointment and at 28 weeks. Some hospital units are recommended a 36-week HB again. Iron supplementation is not routinely recommended postnatally, despite the fact that 40% of women will be anemic postnatally. And we don't routinely test HB levels postpartum unless there's an additional clinical need, such as a PPH or, for example, infection. However, for example, using myself as an example, when I had my first baby, I'm 5 foot, I weighed less than 8 stone. I had a 400 ml blood loss that was documented as normal, but actually I felt the impact of that blood loss, and my body didn't cope very well with that. And to add to that, I was also vegetarian. So I think it's really important that we look at that individualised care, because I did really need to have a HB, and my iron levels were low, and I did really need to take iron postpartum. But as I say, if we just follow guidelines, I was one of those that quote-unquote slipped through the net. So women are at higher risk of iron deficiency, as we know, but in particular, if they have low iron stores before pregnancy, they've got a previous history of anemia, pre-existing blood conditions such as sickle cell or thalassemia, our younger mums, dietary, of course, a lot of people now as well are on restricted diets, such as vegetarians and vegans, short spaces between pregnancies, in particular less than 18 months, and multiple pregnancy. So the guidance on iron supplementation really varies. So NICE state 65 milligrams of elemental iron, which translates to 200 of ferrous sulfate, and often that's prescribed TDS, sometimes twice a day, for 3 months after the deficiency has been corrected. Then you've got the BSH, recommend that women have an increased risk of iron depletion or have low ferritin levels of 30 or below. And again, I mean, the whole argument around ferritin levels and, you know, what we deem as normal is definitely debatable. But yes, the BHS recommend that women should be offered 40 to 80 milligrams of elemental iron daily. The CDC recommend 27, WHO recommend 30 to 60. So as you can see, there's a real variation in these guidelines, and it does demonstrate the need for further research on best practice. So traditional oral iron supplementation, it is poorly absorbed and often poorly tolerated as well. We speak to lots of mums on a regular basis, and those that are taking high-dose iron will more often than not talk about the symptoms that are associated with that, such as nausea, just in general GI discomfort. And that can sometimes be reported as actually worse than the symptoms of anemia, leading to 50% of people to actually lapse use. And if we see that, it goes into kind of like a vicious cycle, because the more anemic the mother is, the higher dose iron she's prescribed, the more likely she is to become symptomatic, the more likely she is to lapse use, the more likely she is to therefore become more anemic. And then you're kind of on this cycle, and the way in which we tend to get women off of that cycle is by offering Ferinject, which is invasive and a costly procedure as well. So some of the solutions. So preventative supplementation, I think, is key for those that are most at risk from preconception to the 4th trimester for the reasons discussed in this presentation. Postnatally, iron supplementation can be helpful for energy levels and also to support mums to repair whilst bleeding and recovering from birth. Something as well that's important for us to remind postnatal mothers to report symptoms. I think a lot of the time you'll see this kind of normalization of fatigue, when actually we should be reporting these symptoms. These symptoms should be investigated, because, as I say, I was one of those that experienced all of that, and it wasn't until I spoke up for myself that actually then I received adequate care and therefore treatment. So just reminding mothers that, you know, we are here to support you with individualized care, and it is really important that you discuss these symptoms with us, because, you know, if we are just to follow guidelines, which I know everyone's really busy, but if we are just to follow guidelines, then sometimes we see those mothers that do go untreated. It's also, Sorry, there was a point there that I've missed out on my presentation. I don't know where it's disappeared to. But anyway, talking about postnatal supplementation, so active iron is clinically proven to increase iron levels by up to 94%, which is really quite significant. And that clinical data was seen over a 12-week period as well. Active iron is a patented, groundbreaking product, and the ferrous sulfate is wrapped in a whey protein. And this is a really important part, because this unique formulation avoids oxidization of iron in the stomach. So that's when women tend to get those symptoms, because of that oxidization of iron in the stomach. It can make them feel quite sick, nauseous, and so on. But with active iron, what happens is we don't see that because of that protective whey formula. And actually, it's absorbed in the small intestine, which is the optimal place for absorption, but that also ensures that women don't get the symptoms that are usually associated with taking that high-dose iron, and therefore fall into that lapsed use. So active iron is clinically proven. Here are some of their claims that are backed by their research. The bioavailability is better absorbed 2 times. Compliance and tolerability, I mean, usually they're linked, but 4 times better compliance, and the tolerability, there was 6 times less gut irritation. There was a 94%, as I mentioned already, but a 94% increase in iron levels. And this trial was undertaken during COVID, and it still demonstrated significant improvements in energy levels, which for myself, I was quite surprised to see for obvious reasons around that time. Active Iron are also partnering with Ulster University on a study to be undertaken on pregnant women, which I think is fantastic. This is really important as well. So, as I mentioned, we need more data and more research in order to find where our best practice guidelines and should really come from. So they are due to investigate the effects of prophylactic iron supplementation on iron status in pregnant women. And these women will be tested at multiple time points, so one of them being 12 weeks, 28 weeks, 36 weeks, and then again cord blood at delivery. So our conclusion, the postnatal period really doesn't end at 8 weeks for many mothers. I mean, I joked at the beginning that I still feel like, I've just come out of the postpartum, but that is absolutely true. My baby's 6 months old, but I still feel like I'm very much recovering from birth myself. And I think when you become a mum as a midwife, it really is a stark reminder of that recovery process and how long it actually does take. Equipping new mothers with knowledge surrounding the importance of iron at this stage in their life may reduce postnatal anemia and could even impact the prevalence and severity of other health implications. I touched on earlier the association and the growing body of research that demonstrates there's a link between postpartum anemia and anemia in general and depression. And actually one study revealed that there was significantly higher symptoms of anxiety in postnatal women. Healthcare professionals need to provide consistent and high-quality care, and obviously, in order to do that, we do need more research. But of course, we need to take into consideration each family and their individual needs, their background, of course, all of the symptoms that they're discussing with us. And a very common report or, complaint is that women don't feel listened to throughout their time in maternity services. But that study undertaken, or that survey rather, undertaken by NCT, there was over 1,000 women that participated in that, and that was the current kind of general consensus that I wasn't being listened to. We also do need to, of course, reduce the impacts of anemia postnatally to support families during this new big phase of their life. So Active Iron are here today. They've got a stand just outside the room here. Please feel free to come and visit and pick up your own complimentary box. You can try it yourself. I take it myself, as mentioned, and personally, I haven't had any symptoms either, but on high-dose ferrous sulfate, I certainly did. You can also scan the QR code here, and it is also available at their stand as well. And they've got a really great section on their website specifically for healthcare professionals, and that you can utilise that as well for your CPD. Thanks so much, everyone, again. Really appreciate you guys attending the talk. I know that there was a bit of a crossover and a bit of confusion as to what room it's in. So, yeah, I really appreciate you joining me today. You can follow me at The Modern Midwife, and also I've got some resources on my new website there.